Tuberous sclerosis complex. Definition. It is a rare multisystemic genetic disease causing benign cause in the brain and other vital organs, such as kidneys, heart, eyes, lungs, and skin.
On our YouTube channel, you'll find a limited selection of pathology and patient videos. With us, activity speeds up the cell cycle and increases cell proliferation, mainly thanks to its effect on protein synthesis. So, when mTOR is switched off by the Hamartin-tuberin protein complex, it slows growth and division of cells throughout the body. Individuals with tuberous sclerosis have a mutation in either the gene TSC1 or TSC2, and these mutations have an autosomal dominant inheritance pattern. The mutations lead to an altered Hamartin-tuberin protein complex that's unable to switch off mTOR. Because of that, benign tumors and growths called hamartomas form throughout the body. Hamartomas are kind of like tumors, but they're made up of a variety of cell types from the tissue where they arise, rather than a single cell type. In fact, if we think of the tissue like a sheet of fabric, a hamartoma is like a knot in the sheet. Benign tumors and
Applications in nursing. Prepare the suction equipment. Check the proper operation of the vacuum cleaner. Check the connections provisions of aspiration probe. Have a suitable Gettle cannula for the patient's oxygen mask. Facilitate accessibility to the ringing tone, especially if there are prodromes. Procure a suitable and safe environment free of furniture and hard and sharp objects that might cause damage during the seizure. Protect the head, loosen the cloth, raise the protective bars of the structure to avoid falls.
This is Sarah with RegisteredNurseRN.com, and in this video I'm going to be going over multiple sclerosis. And this video is part of an NCLEX review series over the neuro system. And as always, don't forget to check out the free quiz that will test you on this condition. So let's get started. What is multiple sclerosis, also called MS? It is an autoimmune disease that affects the myelin sheath of the neurons in the central nervous system. And what's included in our central nervous system? Our brain and our spinal cord. Now, whenever these myelin sheaths are being attacked by the body, what happens is it affects the neuron, and it causes it to become inflamed and scarred. Now, what's the role of our neuron? Well, our role of our neuron is to send nerve signals to either another nerve or a gland or a muscle. Well, if it's inflamed and scarred, it can't do this. So there is a decrease in nerve signal transmission, which is going to lead to
Pros and cons. Pros: treatment. Medicines to control seizures, anticonvulsants, medication may be prescribed. Surgery: a tumor can be surgically removed in the operation of a specific organ, such as the kidney or the heart. Cons: symptoms. It commonly affects the central nervous system and is the result of a combination of symptoms, including seizures, developmental delays, behavioral problems, skin abnormalities, and kidney disease.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1. Malignant tumors to grow in the brain and other vital organs such as kidneys, heart, eyes, lungs, and the skin. What is the mnemonic to help you remember everything that happens in tuberous sclerosis? The mnemonic to help you remember this is just remember hamartomas, and that's spelled Hamartomas. H standing for hamartomas in the CNS and the skin. A standing for adenoma sebaceum, which are cutaneous angiofibromas. M stands for mitral regurgitation. A stands for ash leaf spots. R stands for cardiac rhabdomyomas. T is for tuberous sclerosis. O standing for autosomal dominant, and dominant has the letter O in it. M for mental retardation. A for renal angiomyolipomas, and S for seizures. For more information on this topic, click on the link in the description.
Issues applied in Ecuador. This series of patients represents the first Ecuadorian descriptive study on TSC. The most frequent manifestations found are neurological, epilepsy, autism spectrum, and intellectual disability. We believe that the initial diagnosis should be timely to prevent the comorbidities associated with this pathology.
The 5 years, and today we have
specialist. We deal with kidneys in kids, and yes, we have the only program in this side of the state, the only pediatric kidney transplant program, and the only pediatric hemodialysis unit in this side of the state.
Yeah, and you obviously are making big headlines for your programs and the success of it. U.S. News Report has honored you for 5 years in a row. What makes that happen?
Well, I think it's a lot of effort in many areas. As you know, we have a large children's hospital with many specialties, and we take pride in what we do. We work really hard, and we're very build these multi-specialty clinics where you're going to see the brain specialist, the kidney specialist. Being a genetic condition, sometimes the parents have the condition as well. And in this clinic, we see the parents as well. So the adult doctors come to the children's hospital.
Conclusion. TSC is a disorder in which a genetic abnormality causes the formation of tumors in the system of organs throughout the body, such as the brain, kidneys, eyes, skin, heart, and lungs. These non-cancerous tumors can cause serious health problems by interfering with the functioning of these organs.
TS, or tuberous sclerosis, is a genetic condition in which people develop tumors in multiple areas of their body. So it can affect the skin, the kidneys, the lungs, the heart, and the brain as well. But one of the most common complications that happens with it are seizures or epilepsy that are difficult to control with medication. There are a couple different types of tumors that can grow within the brain itself. So there are ones called tubers, are within the brain tissue. And those, as they're growing and they irritate the brain around them, and they can generate seizures from each individual tuber. So a lot of times, on the MRI, we can look at the pictures and we can see multiple tubers throughout the brain. And if we know someone has seizures, it's a question of, well, which tuber is it coming from? Where is it coming from? And is that something that we can remove to help control or completely control the epilepsy? The other emergence that there's been with TS is that there are medications that actually can help shrink these tumors. And so they can work in different areas of the body, but with the ones in the brain as well, in addition to shrinking the tubers, they actually can help